Amaurosis fugax caused by a branched retinal artery embolus. Definition: Amaurosis fugax is a condition in which person lose sight in one eye. The loss of vision in the affected eye may be total or partial. It usually lasts just a few seconds or minutes. Then it returns to normal. Occasionally, it may last for several hours. This is caused by interruption of blood flow to the artery that supplies blood to the retina.
This is Dr. Carlo Oger, emergency physician and founder of edxitvideo.com. This video is about amaurosis fugax. AF means a loss of vision out of one eye. If you were diagnosed with AF, amaurosis fugax, then you should come back to the emergency room if your arms get weak, numb, or paralyzed, especially on one side. If you have vision loss, trouble speaking, or trouble thinking. If your chest hurts or you get short of breath. If your eye hurts, even if you can still see fine. If you have any other signs of temporal arteritis, as will be described later, or you have other concerns that weren't addressed during your first visit. Amaurosis fugax. It can be total or partial, and it is not permanent. It will go away. Another name is transient monocular blindness. Usually vision goes back to normal after a few seconds to a few minutes. Vision is often normal again by the time the person seeks medical attention. This can make it harder to find a cause. People who have had AF often say it was like a shade or a curtain came over my eye. Usually it happens because an artery that brings blood to the eye was blocked. This is called retinal artery. The blockage often happens because of blood clot or plaque. Small piece of cholesterol breaks off from the larger artery. It then travels to the eye. It gets trapped in the retinal artery. AF also happens when blood flow to one eye is low. Blood vessels bring blood to the eye. Blood flow can get low when one of them gets narrowed. When older patients get AF, it can be a sign of another serious giant cell arteritis. It also called temporal arteritis. It usually happens to older people more than 50 years of age. The blood vessels in the head and neck get inflamed. It can cause symptoms like AF. At first, vision problems may be temporary. However, it can make people go blind. This blindness may be permanent and not go away. Other symptoms of temporal arteritis are severe headache over the temple side of the head, is tenderness to palpation. You can almost see the temporal arteries in their temple. And vision problems. The jaw may also ache or hurt while chewing. If you have any of these symptoms, you must go to the emergency department right away. And for a detailed video about temporal arteritis, please see the video that corresponds to that on my channel, the edxitvideo.com. Treatment. The treatment of AF is really non-specific. It depends on what caused it. So the most important thing is to figure out why it happened. Then we can treat the cause. We may need to do another test to find out the cause of AF. Often you can see your doctor to arrange some of these tests, and some of them need to be done emergently in the department. An ultrasound of the carotid arteries of your neck.
Causes and symptoms. Amaurosis fugax are caused by a loss of blood flow. This can be due to a buildup of cholesterol and fats in the arteries of the heart, or if some of that plaque comes off the artery and gets into the bloodstream, it can flow to the artery that supplies blood to the retina, blocking the flow of blood to the retina. When that happens, vision is lost for as long as the blood flow is interrupted. Painless, sudden loss of vision in one eye, visual loss is often from the top down, apparently like a curtain being pulled down over the field of vision. Rapid return of vision. Vision generally comes back in a few minutes to several hours.
Amaurosis fugax, a symptom described as a shade coming down over the eye, a partial or complete loss of sight that is temporary. This temporary interference with vision is usually related to atherosclerosis in the blood vessels that supply the brain. It can also occur with excessive acceleration, as in flight. Amaurosis is the Greek word for darkening, dark, or obscured. The ancients used it to refer to dimmed vision, especially if there was nothing they could see that was wrong with the eye.
Applications in medicine. Typically, patients describe diminution or absent vision in one eye that progresses over a few seconds and lasts from seconds to a few minutes. The impairment progressively may involve the entire visual field. The loss of vision usually begins in the upper field, less frequently in the periphery, and rarely in the lower field. Pros and cons. In many patients presenting with amaurosis fugax, the diagnosis will be established after the clinical or ophthalmic examinations. The examinations may have uncovered dry eye syndrome, a posterior vitreous detachment, or some other ocular condition that has caused the transient visual disturbances. The eye care provider can manage this condition, but if the diagnosis has still not been established, further evaluation is warranted. Issue applying in Ecuador. Patients with amaurosis fugax are at the risk for stroke, myocardial infarction, vision loss, and the other serious sequences. Although case history, careful clinical and ocular examination, and appropriate system testing will lead to the best possible outcome for these at-risk patients. Conclusion: Amaurosis fugax occurring in the younger patients are probably associated with a more beginning clinical course than that seen in older persons, and that migraine is likely caused for the episodes of visual loss in a majority of this group. Because of this, we believe that a conservative approach to the evaluation of such patients seems warranted.